Good morning and good afternoon, depending on where you are in the state. Thank you so much for joining us today on another part of our Wednesday briefing series. Let's just jump right into it. And I do want to say in advance that if you see me looking this way and then off to the side as well, I'm working with two screens. So it's not that I am ignoring you all, it's just that I am looking at my other screen to make sure everything is going well. So as per usual, if you want to introduce yourself in the chat by putting your name, your organization, and the county in which you are currently working in or residing in, please feel free to do so. As a reminder, the briefings will be recorded and the slides and the recording will be sent to you all sometime this week. And again, as always, we will have time for Q&A towards the end of our conversation today. So if anything pops up in the midst of it, please look for the Q&A section down at the bottom of your screen and put in your question, and we will be sure to try our best to answer it. So let's keep going. Again, our Wednesday briefings, they are now monthly instead of weekly, what we were doing before, and they happen on the third Wednesday of each month. And our next meeting will take place November 19th. So we have a few speakers today. First, I am Danielle Branch. I am the moderator for today. I work with our health advocacy team. I'm a health policy and advocacy associate. And then speaking in terms of healthcare today, we have Jane Denwobi. She is a staff attorney and Equal Justice Works Fellow here at TJC. And then for nutrition, we have our Senior Director of Nutrition Advocacy, Sydney Anderson. So I want to read a disclaimer before we really get started. The Tennessee Justice Center is a nonprofit tax-exempt organization that is nonpartisan and non-political. The clients we serve and the partners with whom we work represent the state's diversity of political affiliation. Our political analyses relate solely to the defense of health and nutrition programs and do not imply endorsement or disapproval of any party or person. All right, we can get things started, and I will pass it over to Jane to start things for healthcare.
Thanks so much, Danielle. And thanks everyone, as usual, for being here. We're so glad to have you all on to talk about some pretty pressing issues related to Medicaid and SNAP. So we started these briefings in response to the One Big Beautiful Bill Act that triggered quite significant cuts to the Medicaid and SNAP program. But in addition, we're now facing a very dramatic and very confusing time completely separate from that, which is around the government shutdown. So last month's briefing, we gave you all a preview that if the federal government, the Congress didn't reach a continuing resolution by September 30th, then the government would shut down. That is what happened as of October 1st. And since then, it's caused quite a bit of confusion around the understanding of the Medicaid and SNAP programs. So first things first, why is the government shutdown happening? What does that mean? What does it look like? Democrats and Republican votes are required to reach a continuing resolution to fund the federal government. Democrats are withholding their votes en masse to demand a permanent extension of the Affordable Care Act's enhanced premium tax credits. This is significant because the premium tax credits are, for by and large, the way people afford health insurance through the marketplace. And they're saying that they will not provide their support for a continuing resolution to fund the government if those extensions are not made to the enhanced premium tax credits. We're in a position where President Trump is directing Congress not to negotiate with Democrats, which is extending the shutdown. Republicans do not want to play ball with this negotiation, although there are some hints that that might change. And because of the tension of the moment, there is a growing bipartisan support for extending the enhanced premium tax credits. We'll talk in detail about the tax credits for the bulk of the health portion of this presentation, but that is how it all fits in. So the premium tax credits are the negotiation point during this government shutdown. And so a lot of the conversation around healthcare is focusing on that, and rightly so. So we're going to give you all the information you need to keep up with those conversations and take action as always. So moving on to the next slide. We've talked a lot about what the bill, the one HR1 has done to healthcare. So let's just start off with the big picture, separate from the government shutdown. We are looking at a $1 trillion cut to federal Medicaid funding over the next 10 years. And that number is provided through the Congressional Budget Office. These federal cuts are set to drive another 300 billion in state matching fund reductions. And so we're looking at $1.3 trillion total loss to the Medicaid program over the next 10 years. Less funding for the Medicaid program gives states less options for how they administer it, and that type of bureaucracy, red tape, and difficulty administering the program is what we fear will lead to people losing coverage. And what does that look like? Well, again, an estimate from the Congressional Budget Office is that the actual cost 17 million people coverage. That's a combination of folks losing coverage to the Medicaid program itself, and then the Affordable Care Act marketplace, which is again a way a huge portion of people get health care currently. So, what's buried in the language of the bill that we've tried to tease out, but we will keep bringing this information as we find it, is technical changes that make both the Medicaid program and the Affordable Care Act inaccessible for many people, or unaffordable, like we're talking about with the tax credits. So we're looking at a systemic disenrollment of individuals from the Medicaid program, given the changes that OBA is making. And we are once again in a position to advocate for improvements to the Medicaid program so that we don't see that take effect. One other thing that's critical is nursing home staffing requirements. That's another part of the rule. We are the nursing home system, nursing home facilities are facing a significant change to their quality of care because of HR1. And so we'll talk a little bit about how that will impact care and safety for folks who are actually living in these nursing homes. And what's not on this slide, but we'll also talk about is rural health. OBA is a huge will have a significant impact on rural health because of the connection between Medicaid enrollment and rural communities. So just as a big picture, we're looking at losing lots of funding to the Medicaid program over the next 10 years, tons of lost coverage for real people over that same period, and then technical changes that will make rural communities, nursing homes, and general enrollment in Medicaid and the marketplace really difficult. Next slide, please. So we've spent a lot of time digging through the different portions of the bill. We've given you all fact sheets and timelines of implementation across the different healthcare provisions. So we're not going to spend too much time talking about what doesn't apply to Tennessee, but just as a reminder, because of the headlines that are following the passage of the bill later or earlier this summer, when folks talk about Medicaid work requirements, that will not apply to Tennessee because Tennessee did not expand Medicaid back when the option was available over a decade ago. So, for example, when you hear folks talk about how Medicaid work requirements are going to kick, hundreds of thousands of people off of Medicaid, that is not the case for the state of Tennessee. Also, provider tax changes are not going to impact Tennessee, so we're not facing a cost shifting to the state that would impact our state budget. So what we're going to talk about today are those changes that directly impact Tennessee. And again, we just want to remind folks that there are a couple things that are very, very much in the national conversation that are not applicable to our state. So you can look back at previous slides and our fact sheets that live on our landing page for Protect Medicaid and SNAP in response to the cuts and catch up on some of that. But just wanted to make sure you all know as we talk about the few topics I'm about to go into, work requirements and tax changes and provided taxes do not apply to Tennessee. Thanks. Moving on. So let's start with by far the biggest part of the national conversation right now, which is the Affordable Care Act. So the Affordable Care Act, when it was implemented, created the marketplace, and that is a way for folks who do not qualify for Medicaid, but are not receiving health care through their employer, for example, full-time employment, to get healthcare coverage because otherwise they'd be uninsured, which was the situation before the marketplace was created. Paying for health insurance is expensive because you have a monthly premium, and if your employer covers it or if Medicaid covers it, you kind of just go about your day, not really thinking about that. But folks who are in the marketplace, by and large, need to find a way to pay those premiums, whether they're $100, $300, or $700. And um, what a part of this the structure for the marketplace was to offer tax credits to folks so that if they were in the marketplace and they had those monthly premiums of X amount, they could get a tax credit to make that monthly payment more affordable. This has been in place for years. In 2021, in response to COVID and as part of a mega bill that passed at the time, these tax credits were enhanced. So it was understanding the national situation at the time, economic crisis, it set up a scheme where if your premium was $100, and you or if your premium was a couple $100 and you're getting a tax credit of $100, that tax credit was actually enhanced so that you can get an even bigger discount on your monthly payment. This was really, really critical for folks at a time when there was mass job loss, when COVID had disrupted the supply chain and daily life. And for a lot of people, those struggles never ended. So they still need these tax credits to afford their health care. Um, when HR1 passed, when the bill passed this summer, it did create tax incentives for a large population. It did not create any tax incentives for people who are in the marketplace. So when people are talking about enhanced premium tax credits expiring at the end of 2025, they're saying that the structure that provided affordable healthcare through tax credits for people in the marketplace was not included in OBA. And because it wasn't included in OBA, it's set to expire at the end of the year. So we're in a position to push for an extension of enhanced premium tax credit so that people who need to afford their health care can continue to do so. What's important about this is the entire message behind HR1 is to offer tax credits to many folks. And so we just want to make sure that the people in the marketplace are included in the conversation of who benefits from tax credits. So that's just something that I want to make sure we lay out. Without the tax credits, without the enhanced premium tax credits that we're talking about, people are facing double their premium costs every month. In Tennessee, an estimate is 265,000 people will lose coverage because they can't afford their premiums. They have not paid the full cost of their premiums for almost 5 years and cannot afford for that cost to just start back up. Another 46,000 Tennesseans will struggle to pay their higher premiums because of how drastic the change will be. And it's the risk is that the number of uninsured Tennesseans could rise by 39%. So when we talk about reliance on the marketplace, we're talking about in our state over 600,000 people who are caught in limbo as the government shutdown negotiation happens and as we talk about enhanced premium tax credits. Next slide, please. So I just said a lot, but I think this is a good example, and this is provided from KFF. When you get the slides, you can explore this for yourself, and I'll talk about a little educational tool you can actually use to learn even more. So when we say ACA coverage will soon become unaffordable, let's look at for a household of one that's making $28,000 a year. That's about 179% of the federal poverty level. They were under the enhanced premium tax credits. They were set to pay about $325 a month for their to stay in the marketplace and get the healthcare plan through the marketplace. If these tax credits expire starting January 2026, the portion of their income that they have to pay for their premiums goes up to 5.6%, which would increase their monthly payment to $1,562. That's just one example of how these enhanced premium tax credits have been a lifeline for many families who quite literally have no way to afford healthcare without it. So the fear is if folks see their monthly bill go from $300 to $1,500, they're just going to opt out of the healthcare system entirely because they simply can't afford it. And we don't want that. we don't want people to go uninsured, and we don't want the people that are in the insurance pool to be sicker, because that drives up costs for everybody. So enhancing the premium tax credit, extending the enhanced premium tax credits past 2025 is a really critical way to, make sure that people are healthy. So I just want to give a numerical example for folks to see what we're talking about when we say that premiums will double. This is what that looks like. It's going from $300 to $1,500, and that's even more than doubling. It's going from zero to almost $400, and it's a really big fear for many families that they'll have to deal with these costs. Next slide, please. So that was for an individual, and I just want to provide a quick example for a family of four and give you all an opportunity to look through this information on your own if you are on the marketplace or if you know someone who is. So a family of four who's making with the income of about $75,000 is looking at tax credits going their tax credits their premium payments with the enhanced tax credit scheme going from $2,500 to in 2026 almost $6,000. So there's a huge panic right now around the marketplace, which is why we have been beating this drum for the last couple of months, because we know these numbers, we know these families, we've worked with some of them, and we understand the financial pressures that these costs will bring. And we just really, what we want to avoid is a mass disenrollment of people from their insurance providers. That is not good for anybody if you're uninsured and you can only get your care through the emergency room. So that's what we're talking about when we talk about the Affordable Care Act and the risk of the enhanced premium tax credits expiring. These numbers are very compelling for us and really for anyone who sees them, and that's why the negotiations are so heated. So we have some action items for you all to partake in to push for not only an end to the government shutdown, but an end to a government shutdown that acknowledges and addresses and extends the premium tax credits, because it's a lifeline for many who need health care. So we're really in a position to tip those levers, and I think our constant attention to this and shouting it from the megaphone is the reason that it's still um, that there is some bipartisan support for the extending of the tax credits. So we just want to keep that pressure up. Thank you. Next slide. Switching gears a little bit, I hope if you all have questions, we'll have time to talk through the tax credits. It can be a little bit complicated, but we're here to help and make sure it's as clear as possible. For now, we're going to move on to a different part of a different bucket of concerns around HR1. So one of the things that HR1 did was it repealed something called the nursing home staffing rule. So the nursing home staffing rule was implemented by CMS to increase the quality of care provided to people who are in nursing homes. So that revolved around staffing, making sure that these nursing homes were appropriately staffed so that people who were in their beds and needed water or needed urgent care didn't have to sit there waiting to get the care that they need. Staffing nursing homes is critical to the quality of care of patients, and so, of the residents, I mean. So you can imagine that this was a huge leap forward for that general industry. However, what HR1 did was repeal the nursing home staffing rule. So two steps forward, one step back in that case, where after CMS had acknowledged a need for improved quality of care, HR1 has now repealed it. So it blocks federal regulations that would have improved the health and safety of 1.2 million nursing home residents. And that's for folks who are on Medicaid and pay privately, because a lot of people in nursing homes are on Medicaid, but it affects everybody. So just as context, as I was saying, the lack of staffing in nursing homes has been implicated by decades and decades of research as a reason for dehydration, malnutrition, bed sores, outbreaks of infection, depression, and despair among nursing home residents. So again, being on a path to improving that and then walking it back it's not a good state for the nursing home care industry. So blocking these new regulations is now saying the CMS is no longer requiring nursing homes to have a registered nurse on duty at all times. And these nursing homes are not required to hire enough staff to care for residents who might require critical assistance with their daily activities of daily living, for example. So it's pretty dire. One of the reasons we want to bring this up is that it's very close to the mission of TJC to advocate for folks who are in these nursing home facilities. And we want to make sure that we continue to pay attention to the nursing home staffing role because it sometimes gets lost in the headlines, but it is a critical part of one of the concerns we have following OBA. Next slide, please. And, speaking of those concerns, um, next slide, please. Yes. Like I said earlier, we were already in a place where nursing homes were in need of significant improvement around staffing. Um, and now we're walking back even further from that. So fewer than 1 in 5 nursing homes could meet the new rules requirements, and now we're not even going to get that. Just for in terms of information and walk away with medical researchers predict that the law will cost 13,000 lives a year. That does not count the untold emotional and physical pain of residents who suffer from neglect, or the emotional pain of their family members who have to witness that and they're powerless to prevent it. Um, OBA actually also prohibits the adoption of any new federal staffing standards for the next 10 years. A lot of OBA's provisions are extended over 10 years, which is really, I mean, in terms of the scale and the longevity of what we have to work with in addressing its harms is really, really important to keep in mind. So prohibiting any new federal standards for the next 10 years is I think adds more concern to the picture. But the nursing home staffing rule and the removal of nursing home staffing standards essentially is a really, really big part of the picture here in Tennessee. And we will continue to update you all on ways to hopefully address that. Next slide, please. And then lastly, we're going to touch on rural health. So one part of the debate prior to HR 1's passage over the summer was it was going to decimate rural communities. And this is because rural communities rely on Medicaid. So if you decrease Medicaid funding, you are creating a structure where rural hospitals cannot afford to treat their patients. And in a state like Tennessee, where rural hospitals are already closing because they can't afford to keep their doors open, or they're cutting their services significantly because they can't afford to keep their doors open. Cutting Medicaid was essentially a blow to the rural communities, to rural Tennessee. That's true in many states. And so voices in unison called out to Congress saying the proposed provisions of HR 1 are harmful to our rural communities. And so there was a sort of resolution created, which was the Rural Health Transformation Program. The Rural Health Transformation Program was created to address criticisms that the bill or the act would devastate rural health infrastructure. So it created this 5-year program where Congress would allocate $50 billion in grants to states between 2026 and 2030 to use to pay for rural health care. We'll talk about whether that's really what it does, but that's what's on paper. Um, but if you remember just a few slides ago, I said that the estimated, and this is the Congressional Budget Office estimate of the loss of funds from Medicaid is over $1 trillion. So $50 billion it sounds good for a transformation program, but it is not close to what's needed to address the scale of devastation that is set out by the overall harms of the bill. So for the next 5 years, there's $50 billion available to address rural health care, and those funds will run out in 5 years, while we have another 5 years and forever to unravel the rest of the cuts that come from the bill with regards to Medicaid. So in terms of scale, 50 billion to 1 point something trillion is not quite matching up, but let's talk a little bit more about that. So there are some significant concerns with this transformation program, which go beyond the fact that the dollars aren't enough. States had to hastily submit their plans to CMS, and they have until the end of 2025 to do so. So this is a program that was implemented through the bill's passage in July, and the deadline is in December to start in January. This is a very quick timeline for, if you can imagine, a state level structure that's supposed to address rural health. 6 months is not that much time for a state to completely create evidence-based testing of what will help rural communities. They just kind of have to put together a plan, send it to CMS, and hope it's approved. Half of the funds, so 25 billion, will be distributed to all states who apply. And then the other half is going to be discretionary. This means that the CMS administrator, who right now is Dr. Mehmet Oz, has discretion to award those funds to state on an ongoing basis. There's no performance accountability with the Rural Health Transformation Program, which is to say, states have that money to use according to certain metrics that are very general and are not actually specific to rural health. The assumption is that the money will be used for rural health, but there's no actual accountability that it's used for rural health, whether it's that first billion or the second, that first portion or the second portion. And the grants are actually made to the state to disperse as it sees fit rather than to the actual hospitals or the providers of this care. And we don't know that the funding will reach rural communities. Again, this is where awareness and attention is critical to something that is kind of painted as a really good idea and a really good initiative. And on paper, maybe it is, but it's just done so quickly and so hastily that we want to make sure that here in Tennessee, as in other states, it actually reaches the people who need it the most. So we'll be following the Rural Health Transformation Program here in Tennessee very closely over the next year or so, or next few months as Tennessee applies and hopefully gets approved. But we just want to make you all aware that when you hear about the transformation program, just know the money isn't, the math isn't adding up, number one. And number two, we want to make sure we know where the money is going. So that's it on the ACA, nursing homes and rural health. But I hope that if you all have questions, we can talk about those in the Q&A. I think that's it for me, Danielle. So I'll turn it back over to you.
Thank you, Jane. And as Jane said before, please, if you have any questions or anything like that, please feel free to put it in the Q&A box at the bottom of your screen. And I'm going to put some instructions as well as how to find it. But now I will pass it over to Sigmy to talk about nutrition.
Hi, everyone. Thanks for being here with us again today. I have some updates this week, and our focus for this week and probably the next is really looking at some of the cuts to SNAP. The one that's most in front of us right now are the immediate impacts around the work requirement and the SNAP time limit. I'll touch on the long-term impact because I think it's really important for us to keep focused on the state cost shift and communicating that to our state legislature about how we're going to pay for that. But then I will also want to spend some time talking about the shutdown and how that impacts the nutrition program, specifically SNAP and WIC. I won't say too much about school meals today, but really wanted to focus on some news we have around SNAP and WIC. We can go to the next slide. So sticking to SNAP and the SNAP cuts coming out of budget reconciliation and the law that was passed in July, we've been getting more information in recent weeks about the SNAP work requirements. On our last call, we were able to share that USDA had pushed out guidance on September 4th. There wasn't a lot of complete information there. They sent out a little more information on October 3rd. Again, not real detailed guidance as has come to be expected from USDA during these rule changes. But nonetheless, states are moving forward and trying to put the law into practice. This guidance is really needed from USDA for states to understand how to implement the new rules. And there hasn't been total clarity there from USDA. So states are trying to work through that, including our state here, Tennessee. Tennessee, from that guidance, Tennessee pushed out some information around their plan for the work requirement on September 22nd, and it gave some of the basic rules. And just to run through some of those real quick, the work requirement rule, which was already in existence, is expanding. And so now it's going to impact older Americans ages 54 to 64, households with children over the ages of 14, veterans, houseless individuals, and children aging out of foster care. The most specific information that DHS provided in their September 22nd guidance that they pushed out is that there's a deadline of October 31st to submit verifications to prove exemption from the work requirement. And again, just clarification on the work requirement, families have to prove that they're working at least 20 hours a week in order to continue to receive SNAP. If they cannot prove that they're working, and if they're not able to prove an exemption, then the household will be kicked off of SNAP after 3 months, and they won't be able to get back onto SNAP for 3 years until the clock resets, unless they're able to prove an exemption or prove that they're working. So those are some of the basics around just the rule and what's come out so far. Some of the things that are still up in the air and that we're trying to get clarity on is when the clock starts for the 3 months. If we were following past rules, the clock wouldn't have started until November 1st when DHS is requiring people to submit documentation. So if that's the case, then families would have until January. However, there's been lack of clarity from USDA, including their insistence that all of this starts on July 4th when the law was passed. But that goes against past precedents, and in all fairness does not give individuals notice or information that they need in order to follow the rules. So we'll share that information and clarity once we have it, but this is what we have so far. I think the other thing that's really important, and we're trying to gather information to share for folks, are the stories, but then also the impact that this is going to have on families. And we're working on an impact resource that we'll share before the next briefing. But just to give you some of those highlights, or lowlights, more so, I think more so appropriate, because of the work requirement. It's anticipated that up to 134,000 families with children could lose access to SNAP. 15,000 veterans could be impacted by this work requirement. 5,000 children aging out of foster care, and up to 9,000 individuals who are struggling with housing insecurity in Tennessee. So this law will have real impact on Tennesseans. So we continue to monitor this. I think the other thing that's also important to understand about the improper guidance and what it's creating for states, it could lead to people being cut from SNAP who shouldn't be cut from the program. It'll lead to caseworker mistakes, and could also ultimately lead to higher error rates. And I will get to that a little bit on the next slide. So the error rate has a lot to do with the cost shift to states and the impact of what the cost will be for Tennessee to be able to pay for SNAP benefits. And this is something that I'm not going to focus on too much today, just because of I want to spend more time talking about the shutdown and what that means for families. But this is something that we need to keep very, very close and be talking to legislators about. Is just the cost that will fall to the states. The administrative cost is estimated to be around 67 million additional dollars to the state. And then the benefit amount, depending on the error rate, and the higher our error rate, the more the state will have to pay in benefits to families. Again, benefits have never been the responsibility of the state. It's always been a federal responsibility. The federal government gives dollars to states in order to pay out the benefit. But that is shifting because of this law. And so I think it's important for us to make sure that legislators understand what that cost is, push back where we can, and make sure that there's money available to families so that they continue to receive SNAP. And again, I'll go into this more probably in the next briefing, but for now, I think it's important to shift to the shutdown and talk a little bit about some of the immediate fires that are happening. All right, on the government shutdown side, I really wanted to focus on WIC and SNAP. There was a lot of information going out early on about WIC not being able to reach families and have enough money past a few days. We've gotten a little more clarity on WIC. All the programs right now, as of October, SNAP, WIC, and school meals continue to reach eligible participants. SNAP benefits are getting out. WIC, Tennessee, the TN WIC folks have shared that programs continue to operate as normal. The early threats that WIC had just days were not true. That program continues to reach families. States have some workarounds at the state and federal level. USDA has made sure that up to $150 million in contingency funds are available for WIC. States can also tap into rebates from infant formula sales, and can also use leftover funds to pay for WIC during the shutdown. So I know the state is working to make sure that the doors stay open for WIC. USDA has also indicated that they will reimburse states that have had to put out any state funds during the shutdown. So right now, WIC benefits remain available to families, but still it's important to talk to legislators. And I also will talk a little bit on the next slide about the other part of WIC, not just making sure that it's available to families during the shutdown, but part of what we're fighting here for is the 2026 budget. So if we go to the next slide, I'll go into a little bit of detail about what our ask is for WIC. Again, once the Congress gets back to negotiating, we want to make sure that WIC funding stays in place for 2026. We've created a letter to legislators to fully fund WIC in the 2026 budget. The House Appropriations Committee has indicated that they are not on board with fully funding WIC. They want to reduce the CVB by 10%, and the CVB is the benefit that allows extra money for families to pay for fruits and vegetables. We don't want that to go away. We want families to continue to have that money. The Senate version, on the other hand, fully funds WIC and has passed out of the Appropriations Committee. Their bill provides $8.2 million for WIC and also serves to anticipate a larger caseload. And the Senate bill is really what we want. And so in 2026, for the 2026 budget, again, WIC is one of these pieces that we want to make sure is funded. The White House has also indicated that they are supporting full funding for WIC. So that is also positive messaging that we've heard come through. But if folks are able to send a letter to their legislators about funding WIC, we want that to happen as well. I'll move on to SNAP next. Just a little bit of information. And again, this information is coming, coming within the last few hours or so. So we're learning more around what's happening with SNAP, and we'll probably have more to push out. So sign up for our alerts if you aren't getting them. But if the shutdown continues, we're really concerned about SNAP benefits that might be at risk of not reaching families. The end of last week on Friday, states started hearing from USDA about a request not to submit for November benefits. And if states aren't submitting their request for November benefits, that means November benefits are not going to get to families on time. USDA sent this memo out on Friday. This is not unprecedented. A similar letter was sent in 2015, but that was different circumstances. But it was followed by a second letter telling states to load cards. We hope that that's what happens again this time around. We think it's really, really important that families continue to receive their SNAP benefits, whether the shutdown is in effect or not. Families need to eat, they need their benefits. So we've been urging households to reach out to constituent services and let them know what the impact is to them if their benefits do not come through in November. And again, under the last Trump administration, during the longest shutdown that we've ever been through, it was 35 days. The Trump administration worked with Congress to make sure that benefits were loaded in advance of November. And so it's not too late, but the time is running out. So we're asking folks to reach out to their legislators and constituent services to let them know what the impact is for families to not get benefits. The other thing that I would say, again, Congress and USDA has worked to get benefits to families in the past. They should do that again. So that's what we're really trying to urge Congress and the administration to do. And I think that might be it for me. Happy to take questions during the Q&A time. Oh, sorry, I already said this, but the shutdown threatens SNAP benefits for November. Again, beyond asking households, I know many of the folks on the line do direct service, so you also have the power to let legislators know what this means for the families that you serve. And we really do not want families to go hungry because of the shutdown. So yeah, so this is our messaging. Please share it out. We will continue to push for families to be fed and to receive their benefits, both SNAP and WIC, during the shutdown, and fight for the shutdown to end with the support of SNAP and WIC and the EPTC as well. So I will end there and turn it back to Danielle.
Thank you, Signe. As said before, if you have any questions that come up, please feel free to put them in the Q&A section. We'll be getting to that in just a second, but I want to reiterate what has already been said as far as what the focus is now. We really need to spread the word about the urgent need to extend enhanced premium tax credits and to enable working Tennesseans to keep their health coverage. And similarly, we need to contact Congress members to tell them to please fully fund WIC. And then on the same side for nutrition, we need to make sure that we are contacting our legislators and ask them to keep SNAP benefits coming to families regardless of the government shutdown. And so some ways that you can really amplify this message is you can post on social media, you can send letters to the editor and op-eds, but just really emphasizing the need for these programs and pushing back, especially when people have been saying that no one will lose coverage. or that people won't lose their benefits. And moving right along, we can jump into our Q&A section. So I know that there are a few questions right now. The first question is, how will EMS be affected? And I believe I can pass that to Jane.
Yes, yes. So that's a great question. EMS refers to emergency medical services. This is very, I mean, critical care. This is really significant because when we're talking about Medicaid reductions, that's across the board, to providers across the board. So EMS is included in that. When there's less funding for the hospital system, there's less funding for EMS services. This is happening when in many rural communities, actually, the only care available is through an emergency unit. So if there's if there are even less dollars, less Medicaid dollars that can reimburse the care provided through those facilities, they are once again going to be in a position to close because they can't afford to stay open. So EMS is completely implicated in the situation that we're talking about here. And um, given that's a critical part of rural areas, which I'm sure is why someone asked, is very much in danger as part of the broader hospital system. So we are including EMS when we're talking about destabilizing rural healthcare.
Perfect, thank you. There is a question now for Signy. Are there any updates on when the immigration eligibility criteria for SNAP will go into effect?
Yeah, thank you for bringing that up. I left that off because we were anticipating the guidance to come through on September 30th. USDA did not provide any guidance. And I think because of the government shutdown, that continues to be delayed. So sadly and unfortunately, no, there's no clarity on the guidance for immigrant families. But we will continue to watch for that and lift up any information that we have on how to message and serve immigrant families during in light of the changes.
Perfect, thank you. The next question is back to you, Jane. Has anyone heard or know why people on disability are losing their benefits with no warning? As I've been told that when they lose that, they lose Medicaid.
I think that sounds like a case specific question. So I would really encourage this person to reach out to TJC. Like we said, the Medicaid provisions in HR1 are supposed to take effect over the next 10 years. With the exception of some of the immigrant eligibility, there aren't HR1 specific, like OBA specific changes that would result in people losing coverage. But again, TJC does take clients. We have direct representation as part of our work. If someone has questions about losing disability benefits, Medicaid benefits right now, that's definitely a question that you should reach out to us directly about. And our comms team always puts our email in the chat and we can work through your specific situation. But yeah, the concerns around disabled folks on Medicaid are kind of roped into the technical changes over the next few years. But hopefully with some more details, we can maybe get you some information.
Perfect. Thank you both, Jane and Sydney. Seeing as there are no more questions, I will move us right along. So the next thing is the call to action. Of course, I've emphasized before that we really need to be contacting our legislators, but also there are other things that you can be doing. Voting is one of the most powerful ways to advocate for your community. So please, if you are not already register to vote or encourage others to register to vote if they have not yet. Another way is to follow TJC on social media. We really update you all throughout the week about different things that we've discussed on this call and things that come in just in time. And then one more thing that I would like to remind you all is to sign up for our newsletter. Again, similarly to our social media, we really do update you all as soon as we receive the information. We try to get it out to you. So if you are already signed up for our newsletter, perfect. If you already follow us on social media, perfect. But of course, we would love for everyone else to have this information as well. So if you can share it with 5 friends, with your different inner circles, we would greatly appreciate it. So next, another way that you can really get involved in some of the things we do at TJC is to share your story. This is really an impactful way to change hearts and minds when it comes to speaking with our elected officials. And there are 3 ways that you can share your story. One is you can use the secure online form at tnjustice.org/stories. And that website will also take you to where you can view many of the stories that have already been published. And then another way is you can call the number that I just sent in the chat box and leave a voicemail. And then the last way is to email stories@tnjustice.org. I really want to emphasize that right now, with the government shutdown and with us really urging legislators to extend enhanced premium tax credits, we're really trying to ask for people to share their experience on the ACA marketplace and with enhanced premium tax credits. So many people, I'm sure, think that maybe their story won't be impactful or they just don't have anything to share, but I must say that that is not the case. Whatever your experience is, we welcome it because you never know, you could be the one to change the mind of our elected officials. All right, moving right along. So again, I just want to remind you all that we are not having these Wednesday briefings weekly. Instead, they will be monthly on the 3rd Wednesday of every month. And our next meeting will take place November 19th. And then I also want to remind you all as well, because there were a few questions in the Q&A, that the recording and the slides will also be sent out from today's call. And then I also want to let you all know that we are having our Medicaid eligibility boot camp. It's at the end of this month. It's 2 days, the 29th and the 30th. If you are a health advocate, health provider, anyone who just really wants to know more about the intricate details regarding Medicaid eligibility, please, please, please feel free to sign up. And then I want to stop myself there because I see that there is a question in the Q&A box. And this is a question for both Jane and Signy, whoever wants to pop in. But it says, have the Medicaid or SNAP cuts begun?
Signy, I can take this one and then you can chime in. The Medicaid cuts have not begun. However, the SNAP cuts, like Signy explained, are starting to take shape, and we're looking at the kind of changes to eligibility in the program that are going to kick people off. That's pretty immediate.
Yeah, I don't have anything to add to that. Jane's spot on. With the work requirements coming into play, we're going to see people cut from the program, and that's part of the SNAP cuts that were factored. And some of those numbers that I gave of the thousands, hundreds of thousands of people potentially losing their benefits are part of the equation when it comes to the cuts. And we'll share the impact. We're going to put together an impact sheet for folks to kind of get a rundown of how the cuts add up for the time limits, the work requirement piece versus the other pieces of the bill that will inevitably kick people off of the program.
All right, thank you both for answering that question, and thank you for asking that question as well. Checking to make sure there are no more, I will move us right along. So that is pretty much the end. Our contact information again will be shared when the slides are shared. But thank you so much. And I am also putting a feedback form in the chat so we can continue to create an amazing experience for y'all, filled with so much more information. So if you could take that, we would greatly appreciate it. And I know we ended a little early, but we want to give time back, and I hope you all have a great rest of your week. Thank you.